Heart failure is a condition that affects millions worldwide, especially among seniors. Yet many of its warning signs go unnoticed or are mistaken for signs of aging or other less serious issues. Understanding these early, often subtle symptoms can make a life-saving difference. Let's start by understanding what heart failure really means. Despite the dramatic term failure, it doesn't mean the heart has stopped working. Rather, it means the heart is no longer pumping blood as effectively as it should. When blood and oxygen can't circulate efficiently, the body starts showing signs, and some of them are easy to overlook. So today, let's uncover 7 little-known warning signs of heart failure that you or your loved ones should never ignore. 1. Persistent cough or wheezing. While many assume a chronic cough is a sign of a respiratory issue, it could actually be your heart crying for help. Heart failure causes fluid to build up in the lungs, which can lead to a cough that doesn't go away. The cough may be dry, or it might produce white or pink-tinged mucus. Wheezing, like in asthma, can also appear. If you're coughing more at night or when lying flat, this could be a red flag. 2. Swelling in the legs, ankles, or abdomen. When your heart can't pump efficiently, blood backs up in the veins and fluid starts leaking into surrounding tissues. This leads to swelling, or what doctors call edema. Most commonly, this occurs in the feet, ankles, or legs. But it can also appear in the abdomen, making your stomach feel bloated or tight. If your socks leave deep impressions or your shoes feel suddenly tight, don't brush it off as just aging. 3. Unusual fatigue and weakness. Feeling tired after physical activity is normal, but if you're feeling exhausted doing simple things like walking to the mailbox, climbing stairs, or even getting dressed, that's not normal. Heart failure reduces the amount of oxygen-rich blood reaching your muscles, leading to extreme fatigue and weakness. This kind of tiredness doesn't improve with rest and may get worse as heart function declines. 4. Rapid weight gain. Putting on a few pounds over several weeks could be attributed to diet or inactivity. But if you're gaining weight rapidly, say more than 2 to 3 pounds in a day or 5 pounds in a week, it could be a warning sign of fluid retention due to heart failure. This fluid buildup, especially in the belly, is a serious symptom and should prompt immediate medical evaluation. 5. Increased nighttime urination. Getting up once during the night to urinate might not raise concerns. However, if you find yourself needing to go multiple times each night, it may indicate fluid shifting from the lower body into the bloodstream when lying down. The kidneys then filter this fluid, leading to frequent urination. This symptom often flies under the radar, especially since it's common in aging, but paired with others, it could point to heart trouble. 6. Difficulty sleeping or shortness of breath at night. Shortness of breath, particularly when lying flat, is a classic yet often misunderstood sign of heart failure. This happens because fluid from the lower body redistributes toward the lungs while lying down. Many people report needing multiple pillows to sleep or waking up gasping for air. Some even need to sleep in a recliner to feel comfortable. This symptom deserves immediate medical attention. 7. Irregular heartbeat or palpitations. Heart failure can cause the heart to beat irregularly or feel like it's racing or fluttering. You might notice skipped beats or a pounding sensation, even when at rest. This irregular rhythm, known as arrhythmia, can reduce the heart's efficiency and raise the risk of stroke or cardiac arrest. If this happens frequently, it needs urgent evaluation. Now that we've looked at these lesser-known signs, you might wonder, what causes heart failure in the first place? Heart failure is most often the result of other health conditions that have damaged or overworked the heart. These include coronary artery disease, high blood pressure, diabetes, or a history of heart attacks. Over time, these conditions weaken the heart muscle or make it stiff, both of which impair its ability to pump blood. The key to managing heart failure is early detection. That's why recognizing these subtle signs is so important. If caught early, lifestyle changes and medical treatment can significantly improve quality of life and even reverse some of the damage. So what can you do? First, monitor your symptoms. Keep a journal of any unusual signs, swelling, fatigue, changes in weight, or sleep issues, and bring it to your doctor. Daily weighing is a useful tool. Sudden weight gain could be the earliest indicator of fluid buildup. Second, follow a heart-healthy lifestyle. Eat a low-sodium balanced diet rich in fruits, vegetables, whole grains, and lean protein. Reduce processed foods and cut back on added sugars and unhealthy fats. Stay physically active with light exercise like